They can't really explain why you're not feeling well and maybe just take a little over-the-counter medication and come back if it gets worse. That's a very common way for people to find me is my doctor tells me there's nothing wrong, my labs are fine, but I know I can sense in my body something is off. And when we do a more expanded panel or some of the specialty tests that functional medicine brings to the table, we might find imbalances. These tests give me a window into how your cells are communicating. Now, I'm trained to understand and interpret labs in that way. So sometimes we see the whispers at the cellular level. Sometimes we still don't see any cellular changes. And it becomes more of a, listening to the patient and really understanding what they're feeling.
Hi, Lee Aase from HELPcare Clinic, and along with my co-host Dan Hinmon. Today, I'm glad to be introducing to our podcast audience and to our HELPcare Clinic practice, Dr. Dawn Jacobson. Dr. Jacobson is board certified in integrative and functional medicine and preventive medicine. She's going to tell us a little bit more about what that all means. But for starters, we'd just like to have her introduce herself and tell us a little bit about her background.
Certainly. Hello, everyone. I am thrilled to sort of tell you more about myself and about the work that I've done really for the past 25 years in different ways. I grew up in Minnesota, so I'm a Minnesota native. And as I grew up, I knew that at some point I would leave Minnesota, and I did. I spent a little over 2 decades in California with some small stops in Washington, D.C. and Denver, Colorado, and Iowa City, Iowa. And during the pandemic, it really felt right to move back to my home state of Minnesota. And I did so in 2021, landing in Rochester, Minnesota, working as an online doctor. So I had the gift of this really wonderful online job throughout the whole pandemic that was online, and realized I can offer my services both online and in person, and really enjoy doing that type of hybrid practice care. Ultimately, I sought that hybrid practice, not just 100% online medicine, and started looking around. And I've been doing a few jobs here and there, getting my feet wet in Minnesota, doing what I do. And then a colleague of mine said to look into what this new clinic in Minnesota, HELPcare Clinic, was doing. She's like, I think everything you say about what you do is what they do. And eventually that happened, right, Lee? And I'm here today to tell you more about that. But it feels really good, to be here sharing what I do.
It's great to have you, not only with HELPcare, but on the podcast today, Dr. Jacobson. So welcome. Well, let's start by talking a little bit about your specialty in integrative medicine and functional medicine. That's a little Greek to me. So what exactly does that involve?
What I do has gone by many names. Let me just say that. So I've really always had a heart for what I originally called preventive medicine. It's my board specialty. It's been around since 1940. Very few people know that there's been this, at least initially, a vision of having personalized preventive proactive care. Part of the healthcare system, it got lost a little bit. And so my primary practice has been what I call preventive medicine since the mid-2000s. And with that comes the spin-off term lifestyle medicine. And so through preventive medicine, those people created lifestyle medicine. And I did all my training then to kind of build out offering lifestyle medicine to people in the different places that I've worked. Integrative medicine, if you're not familiar with the term, I don't know if it was actually coined by Dr. Andrew Weil, Harvard-trained physician who really wanted to talk about all the global healing traditions on the planet and the evidence around them and how you might offer a bit more than medications and surgery. And he started a fellowship at the University of Arizona, became kind of one of these celebrity doctors, wrote a couple of books, got a huge following long before Instagram. I mean, this was like 1990s, had this huge following. And his vision was really to train MDs, DOs, PAs, nurse practitioners, in my words, in ways to expand their medical kit or offer, again, a wider group of offerings to promote health and wellness and healing and relief of suffering. So I did that fellowship out of my own healing experience. I became chemically sensitive. So some people are just I want to say research estimates about 20 to 25% of people are very sensitive to the chemicals around them. And I was in the operating room doing surgical residency. I was like, around all these soaps that they've since taken some of the chemicals out because of the reactivities. I responded to latex. So I really had to really make some really important decisions, tough decisions, difficult decisions to what does it mean that I train and I'm allergic to the whole hospital and the whole clinic.
Yeah.
And then I did some work in health policy, and that didn't feel like my life calling. I just started burning out doing like public health policy and research. That's what took me to DC. And so integrative medicine kind of found me through my own healing. I had chronic fatigue, really chronic pain that no one could explain. And I went looking for science-based answers. I went looking for real healing, things that the medical community just kind of wrote off at the time. And since then, there's actually more solutions that could have helped me, over a decade ago. And I do offer, really then I think the newest leading edge lifestyle and, integrative therapies for that reason. But integrative medicine really brings in healing wisdom from Chinese medicine, from chiropractic medicine, from massage therapy, from essential oil therapy. And it really gives you a lot of different things that people can try, which can be very helpful.
I think I understand where integrative medicine is a little different from family practice, but I'm curious about how preventive medicine is different than a family practice approach, for example.
Great question. I should say many, a subset of pediatricians, family medicine, physicians, OB-GYNs, even cardiologists now will do an element of prevention where they're looking at, how would you change your diet? How would you bring strength training, aerobic activity, flexibility training into your daily routines in order to prevent something from happening? It just depends on where in the prevent sequence you come in. I've always been, and what preventive medicine trains you to do is prevent the disease from even happening. So at the time I was training, I didn't have a lot of the diagnostics I have now, but I have some pretty amazing diagnostics that I bring in through my training in functional medicine primarily to help me understand what's going on in the body long before you're sick. Or what I tell people, you want to see me when you're well. I mean, there are benefits to seeing a doctor like me, a real preventionist, so to speak, when you're sick. It's never really too late to start. But really, I'm in the subset of doctors that would do personalized, proactive, preventive care now. Again, it's called different names to really balance cells. So I even talk about holistic or integrative medicine at the cellular level now, when the body is maybe talking to you in whispers, rather than a big pain and suffering that might come after there's been an established disease in the body. So I come in very much on let's prevent the disease from even emerging or reversing things like prediabetes or high blood pressure, high cholesterol. Let's get things going where those can be normal, if not optimal. So we talk about optimal, not just normal in functional medicine.
I just want to say that's one of the reasons that we were super excited to have Dr. Jacobson joining with us in the practice with HELPcare Clinic, is that really is an approach that's fundamental to how all of our practitioners think. I mean, Dr. Strobel, you've gotten to spend some time with him and with the others that they're interested in this, but Dr. Jacobson's more extensive training and some of that we think is going to be a good way for them to be able to learn from her, and she's going to learn some things about primary care too, and that together there's going to be a great synergy, I guess, between them.
Yeah, I'd say another key difference, and I've talked about this different ways over time as well, is I've kind of, like primary care, family medicine, pediatrics, oftentimes there's still an acute illness part of the clinic. And I've really phased that out. A lot of this is chronic disease prevention. But interestingly, when you do balance the body, you're less likely to get an infectious disease. But I don't do some of that urgent care. And I've really, integrative functional doctors often step away from that to provide the long-term, more management of prevention and balancing treatment of chronic disease.
Well, I think that's part of what you were seeing too, is that, somebody needs to deal with that acute condition. And that's where having a primary care clinic, a direct primary care clinic that's set up to handle that as well, enables you to specialize in the things that you're best at and where you can have the most impact, while also then making that kind of service available to the broad scope of the members who are part of HELPcare Clinic.
Yeah, and if it's not too difficult to explain this, I'm intrigued by your idea that when your body whispers, You can respond before it's, I guess, shouting, right? How would you identify the whispers?
So the whispers are often those things when you kind of feel something's off in your body. You just kind of know that something doesn't feel right, and you go to your primary care doctor. Maybe not a doctor at HELPcare. They would be alert to these things too, actually. But just the regular primary care doctor that hasn't really branched out from that. And they do 5 or 6, maybe 11. I think I counted that primary care doctors do about 11 tests out of the 70 that I start out with. And they tell you everything's normal. They can't really explain why you're not feeling well, and maybe just take an over-the-counter medication and come back if it gets worse. That's a very common way for people to find me, is my doctor tells me there's nothing wrong, my labs are fine, but I know, I can sense in my body something is off. And when we do a more expanded panel where some of the specialty tests that functional medicine brings to the table, we might find imbalances. These tests give me a window into how your cells are communicating. I'm trained to understand and interpret labs in that way. So sometimes we see the whispers at the cellular level. Sometimes we still don't see any cellular changes. And it becomes more of a, listening to the patient and really understanding what they're feeling. I often talk about using 4 types of data. I was going to make sure I got this into the podcast today. The lab data is very important. Expansive testing beyond, what you would get in a regular primary care office. Sometimes what a specialist would do, but even beyond that. So there's lab data. It tells you personally what's going on in your body right now. Then it's what you're doing at home. Like, how are you eating? How are you sleeping? How are you moving your body? Do you get stressed? Do you have spiritual practices? So what you're doing is going to influence cellular expression. Then it's how you feel when you do it. Do you have joy? Do you have energy? Does it deplete energy? Is some supplement giving you a side effect, or is it actually moving us toward how you want to feel? And the 4th type of data, I'm not saying this is in any specific order, is what the evidence that exists now guides me to ask you to do. It's just one of 4 different types of data. It's important, but it's a synergy of all of them. I tell people there's many types of data and all of them are important.
Really interesting. How will HELPcare help you provide the kind of medicine you want?
First of all, they're open. I would say the providers are open and curious. They want to learn. And I learned through my own healing crisis, I wanted curious doctors. I didn't want someone to say, oh, checked all the boxes, come back if it gets worse. I was already feeling pretty bad. So I needed an element of what is healing? What is health? What is wellness? And I sense that environment at HELPcare is wide open with that. Integrative means integrative, not complementary, not alternative, right? So there's an interweaving of things. And I see that at HELPcare as well. Bringing in expanded lab panels. I think, Lee, I'm not the only person getting integrative training.
Right.
I've completed mine, but there are other providers that are interested in offering this type of care.
They're all, yeah, they are exploring this on their own too. And this is just a great opportunity to be able to work closely with someone who's had a little bit more experience in this and some more formal training in the kind of medicine that they like to do already anyway. So it's been great.
Yeah, it felt like home. I will say that. You often say that people who end up working here, it did. It felt like home, family right away. I would say the 3rd thing, though, and this speaks to what you've done with just the direct primary care model and how you offer memberships to people. I've worked in a lot of different, I've worked in places that have different business models. And if anyone out there is listening about, what's the value added, why don't you bill insurance, things like that, there is a wonderful way this practice brings together freedom of choice, freedom of activity in an affordable way that is, to me, also part of the new medicine that's emerging. And it's really exciting to be part of that. Let me just in case someone has questions about the business model out there.
Yeah, but we're really glad to have you with us and to be able to, sort of forge this path together as we're looking to help shape the future of what medicine's like in southern Minnesota. We've been really excited about the reception that we've gotten overall for the HELPcare Clinic model in this part of the state. By the first of the year, we'll have around 2,500 members all together between the sites in Austin and Albert Lea and in Rochester. And so Bringing a second physician into the fold is really exciting too. So we've got wonderful nurse practitioners and a physician assistant who are part of the practice. In fact, a couple that you've worked with before. But it's great that we're going to have another MD part of the practice and bringing that extra level of specialized expertise that you have. So one thing I'd like to ask is, what are some of the things you say people have their whispering that's happening, and maybe there's some shouting that happens with their bodies, but maybe things that people have gone from practice to practice to try to get help, where they've maybe had the labs all seem normal, but they're having skin issues, or they're having other. What are some of those issues that you often see in your practice that where maybe people haven't been able to get help previously, but you've been able to find something underlying that's been able to get resolved and bring some relief?
Yeah, so this brings in the type of training healthcare providers can get called functional medicine. Integrative, functional, lifestyle, they all relate, but they're different. Like, they're different training programs. You learn a different set of skills. And I merge all of them in addition to the healing practice linked to yoga called Ayurveda, which gets into body clock medicine, which we might not have enough time to talk about today. But when someone comes in and they've been kind of told your labs are normal, and that's where I believe anyway, that they're not even emerging anymore. They're well-established tests that get to the root causes of how the body functions. So root cause medicine was first used by functional medicine doctors. Now other doctors use that term as well. But it really meant, what are the functions in the body that are imbalanced? And there's a test for each function. So especially for skin, rashes, itching, hives that come and go, just funny bumps that come and go. Sometimes it's an autoimmune disease. Really, the first place a functional medicine trained physician would go is, what are the populations of bacteria in the gut? Are they balanced or not? Is there too much yeast in proportion to the bacteria? And for that, we do a very comprehensive stool test with a microbiology lab component, would actually grow whatever organisms seem off balance in the lab, to start understanding that. And there's a whole rich body of research around what happens when there's a lot of inflammation affecting the lining of the small intestine or large intestine, how that will affect joint pain, skin, brain function, mood, including anxiety or depression. So we talk about all healing begins in the gut. That's similar to Chinese medicine and Ayurvedic medicine as well. Probably Ayurvedic medicine more than Chinese medicine. But yeah, so it's just, so skin, we automatically start thinking, what's going on with the gut? And the whispers are things we're told to ignore. And if this isn't, well, I just say this because this is just my life. It's there's a way you want your bowel movements: regular, daily, bloating, not too much, the quality of your stool, the rumbling that goes on, the heartburn. These are not innocuous. Just go take the over-the-counter medication to prevent the symptom. You want to get to the root cause. And that's one key root cause we get into in functional medicine. The others that I won't talk about as much are your genome. For like $1,400, $1,500, you can know all the important changes in your DNA that are going to lead to weight gain, lead to diabetes, lead to osteoporosis, lead to dementia. This is being charted out very clearly, and there are things you can take action on now. That's why I'm like, don't wait until you're sick to see me. Like, get your genome tested, understand the bacteria in your gut, understand your stress hormone balance, understand certain key immune function markers that are going to tell me how resilient your immune system is. This is the science of now. This is not the science of 10 years from now. And the best news is, you don't need a disease to see me. You can see me for any reason you want. You get to set the goal, and we do the deeper dives together.
Well, you talked about prevention, and I think one of the things that most people would do almost anything to prevent is Alzheimer's. Like, you talked about dementia, and I know
Yeah.
that you've studied very closely with Dr. Bredesen and his protocol.
Mhm.
So I'd like you to maybe just tell the audience a little bit about that and sort of the theory behind that, and that Alzheimer's isn't necessarily something that just comes out of nowhere that you can't do anything about.
Right. So what I'll first say is, there's a lot of misunderstandings around the Bredesen protocol. And I, of course, see it through my training perspective, including being a preventionist. From day one, I've been a preventionist. And what I learned in medical school was there was Alzheimer's, which was amyloid deposition in the brain. And then there was vascular, like multi-infarct kind of vascular dementia, but they were never talked about kind of together as trying to find a unifying root cause, or of like what you could do to prevent that. They were kind of talked about separately. And there wasn't really much else. Then somewhere in my training, type 3 diabetes became dementia, that you could have glucotoxicity, like glucose, spikes and valleys and things that would damage the brain over time. And cholesterol plaques, we kind of knew that was the multi-infarct kind of dementia thing, the high blood pressure causes. So what Dale Bredesen did, I tell people he was a UCLA NIH Alzheimer's researcher. He did his residency at Duke Medical Center. He did his undergrad at Cal Poly. These are major research institutions. He's a brilliant scientist, but he started asking the question, why is amyloid there in the first place? And his path just took him away from academia because NIH wasn't answering that question. NIH was answering, how do we bind the amyloid and take it out? And Bredesen really is a pioneer, just like Andrew Weil was for integrative medicine, in wanting to get to all the root causes that could cause neurodegeneration. And he still kind of funneled it through Alzheimer's to start because he was a researcher in that field. But now he talks about healthy brain span, just like healthy lifespan. We want healthy, long lifespan. We don't want to have 15 years of disability if we can prevent it, right? So he just has more root causes. So he talks about trauma. He talks about brain-derived growth factors. So there's a growth factor part that's important for the brain that goes into thyroid hormone, estrogen, things that we think of as hormones, in addition to specific growth factors that are being studied in the brain. In addition to good old glucotoxicity, high cholesterol, high blood pressure, and amyloid. And so it's really groundbreaking work. I would say the other contribution of Bredesen is to play brain games. He started that before the research was definitive, and now it's definitive brain games online or playing cards, good old cribbage in Minnesota, setting puzzles, all these things that we do in Minnesota in the wintertime. Keep doing those. He brought that in as a key element in addition to diet, lifestyle, stress reduction, and also toxins. And that's something that, again, I won't have time to talk about today in detail, but toxins like mold, they're very toxins. Mold toxins can be very inflammatory to the brain and to the kidney. Persistent infections like Lyme co-infections, even things like mono, a type of pneumonia called mycoplasma pneumonia, which can really cause problems in the body long term once you have it. There's now a break this summer, which is why I bring that up. He brought that into research that shows when you get a cold sore, it causes brain inflammation. It's linked to dementia. When you take an antihistamine long term, it's linked to dementia. So we're very expansive. Oral health, the populations in your mouth affect dementia and heart disease. So he's very expansive in how he talks about it and how he trains us. And it's like a combination of functional integrative medicine and lifestyle medicine. That's what I do.
Yeah, he wrote a book called The End of Alzheimer's. I don't know if he's had other books, but that's one that I've read. I know Dr. Strobel's read. And I think the analogy uses, like, if you've got 40 leaks in your roof,
Yeah.
40 holes in your roof, if you can plug the leaks, the more the holes you can plug, the less likely that you're going to get wet. And it's kind of the same analogy, that there are a lot of different ways that Alzheimer's or other forms of dementia happen. And if you can start plugging those holes, you can prevent and maybe even turn back the clock a little. Even some, they're saying in this, that there actually can be some improvement in cognitive function.
And he continues to do research, by the way.
Mhm.
Like people one thing we do by the way, that house image, can work for anything in functional medicine. He was just the first one to say it, but it's very relevant. In medical school, I remember being taught, you're brilliant if you can get down to the one root cause, Occam's razor. You're brilliant if you can get the one thing that's causing the disease or the symptoms for the patient. I see it the exact opposite now. You're brilliant if you can figure out the 40 holes, because no one can really think across organ systems. Like, I'm thinking heart, brain, kidneys, lungs, vascular, like the lining of your vessels, the lining of your GI tract, your genome. Very few doctors are trained to think that holistically.
So you're going to be starting with us at HELPcare Clinic in Rochester after the first of the year. So in January of 2026, Dr. Jacobson is going to be joining us, starting for a couple days a week as we're getting started in building that practice. What can people expect when they come to see you for the first time? What does that look like?
Expect to be sort of asked a lot of questions on the intake form. I know we're going to kind of figure out sort of how to piece some of the questionnaires together. I would say come in ready to talk about how you want to create health over time is probably one way to think about it. The first question is, what are your health goals? and I worked for places that ask for 3. I tend to really narrow it down to 1 so we can take a deep dive. But I tell people to bring questions. You're ready to tell your health story from your birth until now. We might not be able to talk about everything, but it matters sort of what's happening now is a cumulative lifetime experience. I would say that the conversations I have, the healing conversations I have with people over time are mostly on the body, but there's a way that we talk about how the mind infects the body and the body affects the mind. And there's a spirit in there too. So I call myself a body, mind, spirit physician now. Again, maybe that's too much to talk about in one podcast, but a person's spirituality, their sense of purpose, what drives them is essential for lifelong health. And there's different ways that people might have that be part of their health story or not. But a lot of the conversation is on, like any doctor, what's going on in your body? How are you feeling? What diseases you have, what symptoms you have. But it always ends up toward, why are you here? What's your goal? What do you really want different a year from now? And then we'll sequence the visits in a way that makes sense for the person. And then there's always a plan at the end of the first visit. The plan oftentimes is testing, but there might be some lifestyle things in there. I might even adjust your medications or maybe add a supplement or two. I like to do that later after I get some personalized data from those 4 types of data we talked about earlier. But be ready to do some testing, get some good blood work to start with, and then come back and then really start synthesizing it and aligning what we see in those labs with your goals. But plans include medications, supplements, all the good lifestyle stuff. Others, sometimes if I want to see another provider, do some specialty testing or something, and then what lab tests we're doing and when I want to see you again. And I like seeing people every 3 months. You can see me more if you want, but every 3 months, and I can really guide someone into the solutions that work for them without anything getting too overwhelming. Does that answer your question, Lee? Is that too much?
Yeah. So we know
Yeah.
that we've been hearing from some of your patients, some of your former patients, some of your current patients who expressed interest in coming to be able to see you at HELPcare Clinic. And we're also excited that for our current members, I mentioned nearly 2,500 of them, or probably over 2,500 by the time we start the first of the year. We'll have an opportunity to have, this will be specialty care, so it's a little extra charge for our current members, to have access to this, but it's also building on the foundation of all the lab tests that are already included for people who have a HELPcare Clinic membership, that you can build on those and then get some additional testing besides that to be able to really tailor to the patient's needs.
Yeah. And I guess this might be a good time to say too, if I grew up in Minnesota. I spent 2 decades in California and moved back. So I plan to continue seeing patients in California as well, in case you have a relative or friend that you think would really benefit from seeing me. I don't have to physically travel to California. And then anybody who comes for care at Mayo, like one patient that is asked to see me, is in Rochester for, maybe up to a year to get some specialty care at Mayo Clinic, and they would like me to be their integrative doctor. And so definitely we can work on things like that. So you don't have to physically be from Minnesota necessarily to see us at HELPcare. And that includes other people there too, probably. But Californians, I'm still here for you.
Well, Dr. Jacobson, thank you so much for spending this time with us today. We really appreciate it. Very excited to have you as part of the team. And I'm sure as patients listen to this recording, they'll see there's some great advantages to preventive and integrative medicine that can really make big changes for people. So thanks for coming on board.
Thank you very much for this opportunity. And nice to meet you. And Lee, thank you so much for bringing me on board. Looking
We're
forward to
looking
it.
forward to having you join us. Thanks for joining us. If you enjoyed this episode, be sure to leave a comment or a review and to subscribe on Spotify, Apple Podcasts, or on YouTube. And also to share Take Charge with HELPcare with your friends and on your social media channels. At HELPcare, our passion is helping people take charge of their health and their health care, helping employers take charge of their health plan expenses, and helping physicians and other practitioners take charge of their healthcare careers. Learn more about the HELPcare Clinic difference at helpcare.health.